I want you to take the next few minutes seriously. Not because I want to scare you, not because I want you to spiral into anxiety about your health, but because what I'm about to share with you could genuinely save your life or the life of someone you love. And I'm not exaggerating when I say that. Pancreatic cancer is one of those diseases that moves quietly, speaks softly, and by the time most people realize it's there, it has already done enormous damage. That's the painful truth. But here's the other truth, the one I want you to hold on to through this entire video. Early awareness changes outcomes. Knowing what to look for, paying attention to your body, and being willing to have those hard conversations with your doctor can make the difference between catching something early and missing the window entirely. I've spent years studying how the body communicates with us, and I can tell you with complete conviction that the body almost always sends signals. It whispers before it shouts, and pancreatic cancer is no different. The problem isn't that the symptoms are completely invisible. The problem is that they're subtle. They mimic other things. They feel like something you could explain away with stress or diet or age. And so people wait, they dismiss, they tell themselves it's probably nothing. And sometimes it is nothing, but sometimes it isn't. And that's exactly why you need to know what I'm about to tell you. So before I get into the 8 symptoms that I want to walk you through today, I want to ask you something, and I genuinely want you to answer in the comments below. Have you or someone you love ever had a symptom that turned out to be something unexpected, something your doctor caught early that made a real difference? I'd love to hear your story because this community is not just about information. It's about connection, and your experience might be the thing that encourages someone else watching this video to take action. So drop your story in the comments. I'll be reading them. Now let's get into it. The pancreas is a remarkable organ. It sits quietly behind your stomach, tucked away deep in your abdomen, doing two incredibly important jobs without ever asking for recognition. First, it produces digestive enzymes that help break down the food you eat. Second, it makes hormones, including insulin, that regulate your blood sugar. It's essential to life. And yet, most people couldn't point to it on a diagram and couldn't name a single thing it does. That invisibility is part of what makes pancreatic cancer so dangerous. When something goes wrong with this organ, the signs can be easy to miss. And because of where the pancreas is located, pain and obvious symptoms often don't show up until the disease has already spread beyond the pancreas itself. Pancreatic cancer is not the most common cancer, but it is one of the most serious. The survival rates are lower than many other cancers, largely because of that late diagnosis problem I just described. But here's what I want you to understand, and I cannot stress this enough. When it is caught early, when it is found before it spreads to nearby blood vessels or distant organs, the outcomes are significantly better. Early stage pancreatic cancer is treatable. Surgery is possible. Quality of life is preserved far more often. This is why what I'm about to share with you matters so deeply. Let's talk about the first symptom, and this is one that shocks a lot of people when they hear it because it doesn't sound like it has anything to do with the pancreas at all. I'm talking about jaundice, that yellowing of the skin and the whites of the eyes that you might associate with liver problems or newborns. But jaundice is actually one of the earliest and most important warning signs of pancreatic cancer, particularly cancer located in the head of the pancreas, which is the most common location. Here's why it happens. The pancreas sits very close to a structure called the bile duct, a tiny tube that carries bile from the liver down into the small intestine to help with digestion. When a tumor grows in the head of the pancreas, it can press against this duct, blocking the flow of bile. That bile backs up into the bloodstream, and the result is jaundice. The skin turns yellow, the whites of the eyes turn yellow, and along with that, you might notice that your urine turns a dark amber or brown color, almost like tea or cola, while your stools become pale, clay colored, or greasy because the bile that normally colors and helps process waste isn't reaching the intestine the way it should. Now, jaundice can be caused by many things: hepatitis, gallstones, other liver conditions. So I'm not saying that if you see yellowing in your eyes, you should immediately assume cancer. What I am saying is that jaundice is never something to ignore or wait out. It is a symptom that demands a conversation with your doctor right away, not next month, this week. Because if it is an early stage pancreatic tumor causing that blockage, catching it at that point is far better than discovering it 6 months later. The second symptom I want to talk about is abdominal or back pain. And this is where things get tricky because abdominal pain and back pain are two of the most common complaints people bring to doctors. And most of the time, they're caused by something completely benign: muscle strain, gas, acid reflux, a pulled muscle from that workout you pushed too hard. So I understand why people dismiss this one. But the pain associated with pancreatic cancer has some specific characteristics that set it apart from everyday discomfort. It tends to be a dull, persistent ache that originates in the upper abdomen, somewhere in that area just below the ribs, slightly to the left of center. And it often radiates through to the back. Not a sharp stabbing pain, not a cramp that comes and goes, a deep, nagging discomfort that doesn't seem to have an obvious cause, and that seems to ease slightly when you lean forward or curl into a fetal position and worsen when you lie flat on your back. That positional quality is important. When lying flat makes pain worse and leaning forward offers some relief, that is your body giving you a very specific clue about what structure inside you is under pressure. The pancreas sits against the spine, and when a tumor grows, it can press on surrounding nerves and tissues in a way that creates exactly that kind of deep positional discomfort. If you have pain like that, persistent, not explained by anything obvious, accompanied by any of the other symptoms I'm going to describe, please talk to your doctor. Don't self diagnose, but don't dismiss it either. The third symptom is one that almost everyone experiences at some point in their lives, which is exactly why it gets ignored so often. I'm talking about unexplained weight loss. And I want to be clear about what I mean by unexplained, because that word carries a lot of weight here. If you've changed your diet, increased your exercise, or deliberately been working on losing weight, that's explained. That's intentional. What I'm talking about is weight loss that happens without any effort, without any change in your habits, without any obvious reason. You're eating the same things, you're moving the same way, and yet the pounds are just dropping off, and not in a way that feels good or satisfying. It feels strange, it feels effortless in a way that doesn't make sense. Pancreatic cancer causes this for several reasons. First, cancer cells are metabolically greedy. They consume energy at an extraordinary rate, essentially stealing nutrients and calories from the rest of your body. Second, when the pancreas isn't functioning properly, it may not be producing enough digestive enzymes, which means your body is literally not absorbing the nutrients from the food you eat, even when you're eating normally. Third, appetite changes often accompany the disease, so people eat less without consciously trying to. The result is a body that is losing weight faster than it should, and a person who may feel more fatigued and weaker alongside it. If you have lost more than 5 to 10% of your body weight over 6 to 12 months without trying, and especially if that's happening alongside any other symptoms on this list, that is a conversation worth having with your doctor. The fourth symptom connects directly to what I just described about the pancreas and digestion, and it's one that I think deserves a lot more attention than it gets. I'm talking about changes in stool, specifically stools that are pale, clay colored, oily, or that float. I know this isn't the most comfortable topic. Nobody wants to talk about their bowel movements, but the truth is that your stool tells you an enormous amount about what's happening inside your digestive system, and it's worth paying attention to. When the bile duct is blocked and bile can't reach the intestines, stools lose their normal brown color and become pale or clay like. When the pancreas isn't producing enough digestive enzymes, fat from food can't be properly broken down and absorbed. It passes through the intestine mostly unchanged, creating stools that are greasy, shiny, oily, and often have a particularly foul smell. These stools may float because of the undigested fat content. If this is something you're noticing regularly, not just once after a heavy meal, but consistently over days or weeks, especially alongside jaundice or weight loss, this needs to be addressed medically. Now let's talk about the fifth symptom, and this one genuinely surprises people. It's the new onset of diabetes. Specifically, I'm talking about being diagnosed with type 2 diabetes. particularly if you're over the age of 50, if you have no strong family history of diabetes, if you haven't significantly changed your lifestyle, and if the diabetes came on suddenly rather than being something that developed gradually over years. Here's the connection that most people don't know about. The pancreas is responsible for producing insulin. When cancer damages the insulin producing cells of the pancreas, blood sugar regulation is disrupted, and diabetes can emerge as a direct result. Studies have shown that a significant number of pancreatic cancer patients were diagnosed with new onset diabetes in the months before their cancer was discovered. This doesn't mean that everyone with type 2 diabetes has or will develop pancreatic cancer. The vast majority of diabetes diagnoses have nothing to do with cancer. But if you are over 50, if diabetes appeared suddenly and unexpectedly, and if it's accompanied by other symptoms like weight loss, abdominal discomfort, or jaundice, your doctor should absolutely be considering pancreatic cancer as part of the evaluation. This is the kind of connection that saves lives when it's caught and gets missed when nobody thinks to make it. The sixth symptom is nausea and vomiting. And again, I want to be thoughtful here because nausea is one of the most common symptoms in all of medicine. Almost everything causes nausea. A bad meal, a virus, anxiety, motion sickness, medications, pregnancy. So I'm not asking you to panic every time you feel a little queasy. What I'm describing is persistent nausea that doesn't have an obvious cause, that keeps coming back, that may worsen after eating, and that is accompanied by other symptoms I've mentioned. In pancreatic cancer, nausea can occur because a growing tumor puts pressure on the stomach or the duodenum, the first part of the small intestine, partially blocking the passage of food and causing a feeling of fullness, bloating, and nausea even after small meals. Vomiting can occur as well. People often notice that they feel full very quickly when eating, that even modest meals leave them feeling uncomfortably bloated, and that the discomfort seems to sit in the upper abdomen. If your appetite has significantly decreased, if you feel full after just a few bites of food consistently, and if nausea has become a regular part of your daily experience for no identifiable reason, this pattern deserves medical attention. Symptom 7 is one of those things that most people chalk up entirely to stress or lifestyle, and the majority of the time, they're right. I'm talking about fatigue, deep, persistent, overwhelming fatigue that doesn't improve with sleep or rest. Now, I want to say clearly that fatigue is an incredibly nonspecific symptom. It can be caused by poor sleep, by depression, by thyroid problems, by anemia, by dozens of other conditions. I am not suggesting that if you're tired, you have cancer. What I am describing is a particular quality of fatigue that goes beyond normal tiredness, a fatigue that makes it difficult to do things you used to do without effort, a fatigue that seems to be getting worse over time rather than better, a fatigue that doesn't respond to rest, that comes alongside other symptoms, and that you genuinely cannot explain. In cancer, fatigue often results from the body's immune response to the tumor, from the metabolic demands of cancer cells drawing on your energy reserves, from poor nutrient absorption, from anemia, and from the general systemic stress of a serious illness. When fatigue arrives as part of a constellation of symptoms, alongside weight loss or abdominal discomfort or changes in digestion, it becomes much more significant. Your body is trying to tell you that something is working very hard behind the scenes. Listen to that. And then there's the eighth symptom, and this is the one that I saved for last because I think it is the most underestimated, the most commonly dismissed, and in many ways, the most important one to understand. I'm talking about itchy skin, persistent whole body itching that doesn't come with a rash, that doesn't have an obvious external cause like an allergic reaction or a new soap, and that particularly affects the palms of the hands and soles of the feet. This symptom is directly related to the jaundice mechanism I described earlier. When bile backs up into the bloodstream because the bile duct is blocked by a tumor, one of the components of bile, called bilirubin, deposits in the skin. And bilirubin in the skin causes itching, sometimes intense, maddening itching. The skin may look yellow if you know to look for it, but the itching can precede visible yellowing by days or weeks. So someone might be scratching constantly, unable to sleep because of the itch, without yet seeing any obvious color change in their skin. If you are experiencing unexplained, persistent itching, especially all over the body, especially on the palms and soles, especially if it's getting worse, and particularly if it comes alongside any of the other symptoms I've described, this is absolutely something to bring to your doctor immediately. So let me bring all of this together for you because I think it's important to see the full picture rather than any single piece of it in isolation. What makes pancreatic cancer detection so challenging is that most of these symptoms, the fatigue, the nausea, the weight loss, the back pain, can each individually be explained by something far less serious. And your brain, like my brain, is wired to reach for the most likely explanation. You're tired because you're stressed. You have back pain because you sit at a desk all day. You've lost some weight because you haven't been eating well. Your digestion is off because you changed your diet. And most of the time, that's exactly right. I am not here to make you terrified every time you feel an ache or notice you've dropped a few pounds. That kind of health anxiety helps nobody. What I am asking you to do is something different. I'm asking you to pay attention to patterns, to clusters, to symptoms that linger, that don't respond to simple explanations or simple remedies, and that seem to be occurring together. One symptom in isolation. Investigate it if it persists, but don't spiral. Two or three symptoms from this list occurring simultaneously in a person over the age of 50 without an obvious cause, that's when you stop second guessing yourself and you make the appointment. Not because you're being dramatic, because you're being smart. Because early detection in pancreatic cancer is genuinely life saving, and the people who survive it are so often the people who listen to their bodies before the whisper became a shout. I also want to take a moment to talk about risk factors because understanding who is at higher risk helps put this into context. Age is the single biggest factor. The vast majority of pancreatic cancer diagnoses happen in people over 65, though it can and does affect younger people. Smoking significantly increases risk, another powerful reason to quit if you haven't already. A family history of pancreatic cancer, particularly in a first degree relative like a parent or sibling, raises your risk. Chronic pancreatitis, long term inflammation of the pancreas, is a known risk factor. Obesity increases risk. And as I mentioned earlier, long standing type 2 diabetes also carries an elevated risk. Knowing whether you fall into any of these categories doesn't mean you should live in fear. It means you should be more vigilant. It means you should be more proactive about routine screenings and honest conversations with your doctor about your personal risk profile. And speaking of conversations with doctors, I want to encourage you to be your own health advocate. That means being specific when you describe your symptoms. Don't just say, I feel off. Say, for the past 6 weeks, I've had a dull ache in my upper abdomen that radiates to my back. I've lost 8 pounds without trying, and I've noticed my urine is darker than usual. That specificity matters. That's the kind of information that prompts a doctor to order the right tests. An ultrasound, a CT scan, blood tests, including one called CA19-9, which is a tumor marker sometimes elevated in pancreatic cancer. It's not a perfect test, but combined with imaging and clinical assessment, it is part of how doctors build a picture of what's happening inside you. Your job is to give them the clearest picture you possibly can. I also want to acknowledge something that I think about often: the fear factor. Pancreatic cancer has a reputation, a serious, sobering one. And I know that some of you watching this video might be feeling some anxiety right now. Maybe you recognized one of these symptoms in yourself. Maybe you thought of someone you love. I want to say directly to you, the answer to fear is not avoidance. The answer to fear is action. Knowledge is protective. Getting checked out is empowering. The vast majority of people who experience any combination of these symptoms will have explanations that are treatable and far less serious. But for those who don't, for the people in this audience whose bodies are genuinely trying to send them a message right now, getting to the doctor early is the single most powerful thing they can do. And I want to leave you with this. Every single day, people are given the kind of early diagnosis that changes everything, that turns a conversation that could have been devastating into one that is manageable, treatable, even curable. Those people often say the same thing when they look back. They say, I almost didn't go. I almost convinced myself it was nothing. I almost waited another few months. And then something, a video, a conversation, a moment of clarity, made them pick up the phone and make the appointment. I hope this video is that moment for someone watching today. I genuinely do, because that's why I do this, not to frighten, to inform, to equip, to remind you that your health is worth fighting for and that paying attention to your body is one of the most loving things you can do for yourself and for the people who need you in their lives. Please, if any of these symptoms resonate with you, if you've been brushing something off that deserves a second look, make that appointment this week. Not someday, this week. Talk to your doctor. Be specific. Be persistent. Ask questions. You deserve thorough, attentive care, and you deserve to understand what's happening in your own body. And if you found this video helpful, I want you to do two things. First, leave a comment below. Tell me which symptom surprised you the most, or share your own experience if you're comfortable doing so. Your words matter here, and they might be exactly what someone else needed to hear. Second, share this video with your family, with your friends, with anyone in your life who you think deserves to know this information. Because awareness is literally what saves lives in cases like this. And you sharing this video is a real, tangible act of care for the people around you. I'll see you in the next one. Take care of yourself. You matter.